Hello, my name is Cheyenne Taylor, and I'm CPR certified by the American Heart Association. And here's my certificate. Okay, today I'm going to demonstrate CPR for you. Now, the purpose of CPR is to keep your blood flow active in your body after cardiac arrest. And this extends the opportunity for a successful resuscitation until help arrives. I'm going to demonstrate two types of CPR for you today, hands-only CPR and conventional CPR. Also, I'm going to show you what high-quality CPR entails and some other tips and knowledge. The first step is to recognize cardiac arrest. Then you want to check the pulse and then call for help, and then start CPR. Now, what is cardiac arrest? Cardiac arrest is an electrical problem with your heart. Now, this is when blood flow to your heart is blocked, which causes abnormal heart rhythm or no heart rhythm at all. After this, after you realize there is cardiac arrest, you want to start CPR right away, because within the first 3 minutes there may be permanent brain damage. If I can get a volunteer now to come up and help me. If I can get you to come up and help me. If I can get you to lay down right here. Okay. I'm going to start with hands-only CPR. Hands-only CPR is exactly what it sounds like. You're only going to use your hands to give compressions. Now we're going to go back to the first step we learned, which is recognizing cardiac arrest. Cardiac arrest patients are usually already on the ground because they have already started and they have lost oxygen to their brain. Now, first we're going to see if he's responsive. Hello, sir. Sir, can you hear me? And when you do not get a response, then you're going to check for a pulse. You're going to check for a pulse using your first two fingers, your first index finger and your middle finger. You're going to check the pulse at the neck. And when you do not have a pulse, you're going to call for help, which I'll either get my phone out and call or get somebody else around me to call. Then we're going to start CPR. Now to start CPR, first you want to find your hand placement. To do this, you're going to find his sternum, which is also known as your breastbone, which is in the middle of your chest, where your ribs connect. You're going to find the end of it and then use your first two fingers here and then do your palm right here. And this is exactly where your hand is going to need to be. And then you're going to take your next hand and interlock it. And then you're going to give your chest compressions and make sure these fingers are straight out and not curled or touching the end of his chest. You're going to give compressions for about 100 to 120 beats in 1 minute. And you're going to do it for the same depth to 2 to 2.4 inches. And you're going to do it to either the tune of Staying Alive or Beyonce's song Crazy in Love. Now the next one is conventional CPR. Now this can be done by yourself or better in teams of 2. You're going to do your compressions just like you did before and do your hand placement with your palm and then interlock your fingers giving chest compressions. But this time, instead of just giving chest compressions, you're going to give them only 30 of them. After your first 30 compressions, you're going to move up to the top of his head, and you're going to tilt his chin upwards, and then you're going to pinch his nose, which I won't actually do. Pinch his nose closed to make sure there's no air coming through there, and then you're going to give him 1 breath of mouth to mouth, and you're going to watch the chest rise, and then you're going to watch the chest fall. And then after the first breath, you're going to give a second breath, keeping his head straight up so his airway is not blocked. And while his airway is not blocked, you're going to give your second breath with his nose closed. Okay, and that's all I need from you, so if I can get you to stand up. If I can get a round of applause for my volunteer. Oh, thank you. Okay. In conclusion, you want to keep these 4 tips in mind for high quality CPR. The first tip is you want to minimize interruptions during chest compressions. You're going to want to do this by, when you have teams of 2 and you're doing conventional CPR, switching after your 30 compressions and you're in between them and your 2 breaths. Now, for your second tip, you're going to want to provide compressions of an equal depth and rate. Now, by this, you can do the rate by either doing Staying Alive or Crazy in Love by Beyonce. And then for the depth, you just want to remember it's 2 to 2.4 inches. And if you're doing a team 2 conventional CPR, then they will give you feedback to help you. And then the third tip is to avoid leaning on the person. And, this includes your fingers when you're interlocked, giving chest compressions. You want to make sure they're straight out and not like this. And also make sure your arms are straight out and not leaning over the person, or leaning over the person when the second person during conventional CPR is giving breaths. So it's better to just put your hands up. The fourth tip is to ensure proper hand placement. What you want to remember to do is find the end of your sternum and use your first 2 fingers, and then put your palm after your first 2 fingers to give your compressions. Thank you for the opportunity to speak about something so important as CPR.